Well, good evening, everybody, and welcome. My name is Michael Greenwald. I am one of the vice chairs for DeKalb Democrats, and it's my pleasure to bring to you this monthly edition of our webinar series on gun violence as part of Gun Violence Awareness Month. We have a fantastic panel for you today, and we're going to jump in and get started. This focus for tonight is going to be on lessons on gun violence reduction from fellow Southern states. It is admittedly a pretty clunky title, but I think you'll see why we chose this focus because we have a lot to learn from states around us that really could be so helpful at us getting a handle on this problem here in Georgia. Now, before we get started, I want to just go over what to expect. I'm going to go over some announcements very briefly and then have a pretty quick background overview on the topic of gun violence. Review some of the data, make sure that we're really starting from the same basic understanding of the topic. Then we're going to talk about the issue with our speakers. Introducing the speakers, I have some questions for them, and then I will ask questions from the audience. If you have questions along the way, please put them in the Q&A. We will get to them either during the portion that we are talking to the speakers or at the very end for audience questions at the final 10 or 15 minutes or so of our presentation. So first, announcements. Early voting has begun. We actually have just a few more days left of early voting here in Georgia. It ends on the 12th. It is steadily increasing, although the turnout rate has been very low. And of course, election day is on the 16th. So please vote, make a plan to vote, and make sure that you are reaching out to your friends and family to remind them of the same. We have some important things happening in the area I want to let you know about. The first link that I want to share with you is the top one that says Fight Back Against Redistricting. We have a number of activities going on regarding the special session coming up next week, in which the legislature is going to entertain possible further gerrymandering of our districts. Please take a look at that. Look at the options. There are lots of things that you can do if you're interested. In addition, tomorrow night, there's going to be a webinar featuring Representatives Panich, Roberts, and Tran, also focusing on this issue, what to expect, and to give us a little bit of insight and guidance. So that's tomorrow night at 7, again, with the link provided in that webinar. On the 13th, South Fulton is kicking off its Safe Summer program with an event that features safe gun storage, as well as Stop the Bleed and other related topics. So if you're in that area, please check that out. The coordinated campaign has a couple of events coming up. One is a social called Sunday Sunday on June 14th in the afternoon, a family-friendly event. And then another one called Powered by Purpose, a way to turn your personal story into narrative. So another, I think, very useful and informative way to express yourself. There are many events regarding Juneteenth coming up around Atlanta and throughout Georgia. I'm going to highlight just a few of them. In Sandy Springs on Friday, June 19th, there will be a lot of activity going on from 5 to 10 p.m. These are actually co-sponsored with neighboring towns of Brookhaven, Dunwoody, Dorville, and others. And then the next morning on June 20th at the MLK Center, the parade starts at 10 a.m. and there are many more activities than that. Please use the link and find out what else is going on that might interest you. And then finally, at the south part of DeKalb in Stonecrest, there's also another parade and activities that afternoon. Georgia Majority for Gun Safety is going to be organizing some canvassing in House District 53 on June 27th. That's an effort to help people kind of connect the idea of gun violence with the act of voting. So if you're interested in that, please click the link to learn more. And then in July, the largest parade, the largest July 4th parade in the entire state of Georgia is in Dunwoody and North DeKalb. And DeKalb Democrats has a float and we'll have dozens of marchers. We hope you can march with us. It's a fantastic event. It's a great opportunity to show our passion and our pride and also to socialize and mingle with fellow Democrats and also some of our elected leaders and candidates. Our next DeKalb Dems webinar is to be determined, most likely going to be on the topic of white Christian nationalism. More details to follow. And then finally, the final link there is if you are not getting this already, please sign up for our newsletter. We have lots of information to share. All you got to do is put your information down and we will share it with you and let you know what's going on week by week. There is no time off anymore. This is a 12-month-a-year enterprise. So, to our topic. Before we get started with our conversation, I want to just share some background information on the topic of gun violence. And I'm going to break it down into the following things. First, looking at the US versus other countries, a little bit of analysis about what does gun violence look like if you analyze it, and then a little bit of a focus on Georgia and how we compare to others with a transition to how can we make things better. So here we go. Gun violence epidemic in the US. 125. That's the number of people in the US that are killed with guns every single day. Twice as many are shot and wounded. Countless others are impacted by acts of gun violence. If you work in healthcare like I do, you see this all the time. And it is not just the person that comes in with the active bleed from a gunshot wound, but it is the family that's coping with the subsequent injuries, the lifelong handicaps that they face, the education hardships, the financial hardships, the social and mental health hardships. This is an epidemic. In a survey, a national survey of US adults, just over 50% said that they or either a family member had experienced a firearm related incident in the US. It's staggering. Over 20% had been threatened with firearm. Nearly 20% have a family member who was killed by a firearm, including suicide. 17% had witnessed someone being shot. 4% had shot a firearm in self-defense, and 4 had been injured. When it comes to child mortality in the United States compared to other Western countries, it is a staggering contrast. We far outstrip the deaths per population size, the per capita deaths, compared to our peers. Let's look and see what exactly this really means when we talk about gun violence, because this is where a lot of confusion sometimes lies and our conversations can go sideways. To a healthcare provider, this is what gun violence it comes to mind. This is an ugly sight. It's chaotic, it's stressful, it's emotionally tormenting, really. But this is just the beginning of the story of gun violence, and it doesn't tell you what happened and why. We have many manifestations of gun violence. The ones that get in the news tend to be mass shootings. Although, to be honest, now I think we've become numb. I just learned a few days ago that we had another mass shooting in Toledo, Ohio. I didn't know about that. I didn't see it in the news very prominently. We are definitely worried about the mental health aspects, and we'll talk about that. The ability for children to get unsecured weapons is a big concern, and also is domestic violence concerns and other forms of homicide. If you look at the numbers in 2022, over 48,000 lives were lost to gun violence, 27,000 to suicide, 19,000 to homicide, 463 unintentional, 643 due to law enforcement, and 415 that were undetermined. This is a snapshot in time, and this is ongoing. It's not your imagination. Mass shootings have increased. We are seeing more and more of these, and unfortunately, lots of copycat shooters steadily increasing. But the point that we try to make clear to everyone is that gun violence is more than gang violence. It's more than crime-related violence. Suicides actually account for more than murder when it comes to the total toll of gun violence in the United States. Nearly 80% of child firearm suicides involve a gun belonging to a family member. This is an important and staggering statistic that should inform how we can proceed to make this problem better. You all have heard this stat before that since 1999, firearm-related injury has eclipsed that of motor vehicle crashes in the #1 cause of death in youth in the United States. That's not because motor vehicle crashes have gone away. If you drive in Atlanta, you know that is not the case. We are seeing plenty of motor vehicle crashes, but we are doing better in terms of constructing the vehicles so that they're a little safer, and our ability to respond quickly to medical and surgical emergencies has improved. But now we are seeing this uptick in firearm-related injury that is clearly something different. In 2024, there were 626 children and teens presenting to a Georgia Emergency Department with a firearm injury. That's the equivalent of a school bus full of kids each month. That's pretty staggering. And where is it highest? Well, per capita, it's highest in our most rural counties, not what many people assume to be more of an urban area in metro Atlanta. Also, in 2026, a study came out from Emory, Rollins School of Public Health, showing that this has now risen to the top of concerns of parents. This is an annual study asking Georgia parents what are their biggest concerns. And in this study, 33%, or a third of Georgia parents, said gun violence was among their top three concerns for their kids, up from 27% from the previous year, eclipsing education and school quality as a top concern. This is an annual survey done every fall, a random sampling of over 1,000 parents, and I hope it gets a lot of attention from our legislators and leaders. We talk a lot about safe storage, and the reason why is because it's the common denominator for youth gun violence data, and meaning that if we could control who should and can't get these guns, we would cut down tremendously in the number of pediatric victims and also non-pediatric victims as well. So let's talk about Georgia for a minute. We are 46th in gun laws out of 50 states, 8th in gun violence rates. An average of over 2,000 people in Georgia die a year. Over 5,000 are wounded in Georgia every year from guns. The average cost of gun violence is over $2,000 per person per year, resulting in $24 billion worth of costs related to gun deaths and injuries. But if we had a death rate of our national leaders, of states that are doing a great job, we would actually save nearly 17,000 lives in the next decade. Mentioned this before. This is a comparison of different counties in Georgia. The darker the blue, the higher the per capita rate of gun violence. You will see, if you recognize Georgia, that some of the darkest areas are those in some of our most rural areas. So it is not, no county is untouched by this, but it is not simply an urban violence issue. If you look at different states, there's definitely a correlation. The top states that have the strongest gun laws, and that's demonstrated by the blue bar, tend to have the lowest rates of gun deaths per 100,000 residents. These are the top ones in our country. When you look at the bottom of the ledger, you'll see where Georgia is at 46, and you see the blue and the red comparison change quite a lot. There is a correlation between gun violence legislation and programming, policy, and the outcome. We know that secure storage laws work. And in fact, a RAND study was published in just this year in January, showing evidence of that. And we have a number of states that have shown that it's worked, including states that are even in the Southeast, including North Carolina and Texas, which is very poignant for today. But Georgia needs to get on this map as well. We've estimated that nearly 300,000 lives could be saved in our country over the next decade if we all follow the same kind of legislation as the leading states in gun safety policies. So policies can make a difference if we can find a way to get there. So how do you implement these policies? Well, it's not always easy to do. There's a lot of politics involved, but one step seems to be to change the narrative through offices that the state sponsors in gun violence prevention or something similar. And nearly half of all the states in our country have something like that. And that's what brings us to our discussion today is what would it look like if Georgia had an office of gun violence prevention? What could we accomplish here that other states have accomplished? Where are other states in terms of their journey toward getting a handle on this epidemic in their own areas? So in summary, the U.S. leads the developed nations in gun access and gun violence, and Georgia is one of the leaders in gun access and gun violence in the U.S. Firearms have been the #1 cause of death in the pediatric population this decade, and suicides outnumber homicides, but there are other manifestations as well, including unintentional injuries, which, by the way, Georgia also leads the nation in unintentional child shootings. We know that the following things seem to be the key: child access protection, also known as safe storage, universal background checks and a waiting period, extreme risk protection orders, and restrictions on military-grade weapons. So the question is, how can our states reduce gun violence in a programmatic way? What's the role of a government office for gun violence prevention? What features make some gun violence prevention offices more effective? And what would be the next governmental step in Georgia to reduce gun violence? So with that, I'm going to stop sharing these slides and introduce our speakers today. We have a fantastic panel, and they're going to share with us some of the things that they have learned in their states so that we can actually do a little bit better job at home. Um, Now, I'm going to introduce them and then I'm going to start asking them questions. And so, in no particular order, I'm going to start with Heather Hallett. Heather is a mother of three and a local organizer who's been advocating for gun violence prevention measures for many years in Georgia. But in 2023, with the help of Representative Becky Evans, she founded the Georgia Majority for Gun Safety to bring together the numerous and diverse groups who advocate for gun violence prevention legislation in Georgia. Heather's leading this coalition to bring about strength in numbers and enable groups to amplify each other's efforts toward making Georgia a safer place to live and raise children. Heather, thank you for joining us tonight.
Thank you.
Next, we have Nicole Golden. Nicole is the executive director of Texas Gun Sense. Preventing gun violence in all its forms is Nicole's lifelong passion. After serving in an interim capacity, she officially took the reins as the executive director of Texas Gun Sense in April of 2022, right before the tragic mass shooting in Uvalde. Nicole definitely managed an emotionally charged crisis response, pivoting the organization from strategic planning in advance of the next legislative session to focus on how Texas Gun Sense could be part of an immediate service to the community in need. She feels her education as a social worker and more than 10 years of experience with gun safety, advocacy, movement building, and public speaking prepared her for this challenge. She's deeply devoted to building toward a future free from gun violence and moving the needle on gun safety through coalition building, legislation, and grassroots advocacy, education, and community-based initiatives. Nicole, thank you so much for joining us tonight.
Thank you very much.
All right. Now we move on to North Carolina. We have two folks who are gracious enough to join us today. First is Dr. Rebecca Palmer, who is a pediatric hospitalist embedded in the pediatric trauma team where she works. She serves as the program director for the Injury Free Coalition for Kids at the Winston-Salem site based at Levine Children's Brenner Children's Hospital, where she leads community-based and clinical initiatives to reduce childhood injuries. Her service includes advisory board appointments with the North Carolina Office of Violence Prevention and Youth Collaboration, a program for gang-involved youth, and she was just named to the North Carolina Gang Prevention and Intervention Task Force and the NCPED's Firearm Injury and Violence Prevention Chapter Champion for 2026 to 28. Dr. Palmer, thank you so much for joining us.
Thank you.
And finally, Paul Callanan is a seasoned public safety and community violence prevention leader with more than 3 decades of experience advancing local and state strategies to reduce gang and gun violence. He serves currently as the Assistant Director of North Carolina's Office of Violence Prevention, where he guides municipalities around the state in adopting equitable, evidence-based public health approaches to reducing firearm violence. Before joining the state of North Carolina, Paul served as director of Louisville's Office for Safe and Healthy Neighborhoods, leading the city's comprehensive gun violence reduction agenda. In this role, he oversaw multi-million-dollar community violence intervention initiatives, secured historic federal investments for community-led safety strategies, and coordinated more than 300 community partners under a unified citywide framework for reducing gun violence. Paul, thank you so much for joining us.
Thank you. Glad to be here tonight.
All right, so I'm going to kick it off with a request that each of you take turns, and I'm going to just call out names. If you all could just, like in 2 minutes, just share a little bit of a personal background about how did you get here? Like, what was the thing that made you decide, I'm going to dedicate my life to be doing this? It takes so much of your own personal time, commitment, emotional energies. And I'm going to start with Heather. Why are you doing this now? What happened? Yeah, it's still on mute, but we're almost there. All right. Well, let you work on that and we'll come back to you. Okay. Nicole, let's give you a try. Can you share with us your perspective on why you got into this?
Yes, I feel for you, Heather. That happened to me recently too. I think she got off mute. You want to go ahead? Go ahead.
Sure. It's because it's connected to that bigger screen and I can't move my cursor. So thanks for the question, Mike. Honestly, I was a teacher when Columbine happened. I was doing student teaching, and so I think that that definitely left a lasting mark with me. And gun violence prevention has always been one of the things that I cared about. I do think that when I saw Philando Castile in Minnesota, he was the gentleman who had a firearm in his glove compartment and was getting out his, license and registration, was pulled over to, just routine traffic stop and was shot by a young police officer. The absurdity of the United States laws just, I think, came into full focus for me, and that I think just moved gun violence prevention up on my list of things where it just felt like this is crazy. That officer seemed so, he was young and he just seemed petrified. And it seemed clear to me that the reason why he's petrified is because there are so many guns out there. And what are we doing to our police officers that we're putting them, asking them to patrol our streets when, we basically have the rates of gun violence of, war-torn countries. And of course, what ended up happening is that young officer took an innocent man's life. And it just was so tragic to me. So I started doing advocacy here in Georgia. It wasn't until 2023 when there was a, fairly high profile shooting in my neighborhood, basically. We just a mentally ill man went into a doctor's office and ended up taking the lives of four people, one of whom was a member of my community. Her children went to the same elementary school that my kids went to. And that basically set off a chain of events. We didn't have a state-based gun violence prevention advocacy organization in Georgia at the time. And so I decided that it was time to get everybody in coalition working, singing from the same songbook to be more effective in our advocacy. And 3 years later, I am here where I am. So that's my story. And I
No,
won't
thank
unmute
you. Okay.
anymore.
Nicole, I kind of gave away a bit of your story already, but what could you add to let people know about how you got here?
Well, maybe my bio was too long and I apologize. That's what we that's just what we have, but thank you
Okay.
for reading it. Um, yeah, I mean you said this, but I've been involved in gun violence prevention since right after Sandy Hook. When my kids were little, they're now teenagers, and I was a stay-at-home mom doing that, and it really, when you hear people say this, and I've heard other people say it, and I'm one of those people, like it really just kind of it changed the course of my life and how I view things, and I didn't um it was a huge wake-up call. I just I looked back after that event and wondered, like, what was I thinking, like, that I wasn't always doing gun violence prevention work, but that's how these moments are.
Yeah.
And that was my moment. It was the moment for a lot of people. So many that a lot of us came together to form what is now Moms Demand Action for Gun Sense in America, which people are very familiar with. And I co-founded the Austin group where I live and just did a lot of work for years and years as a volunteer. And you can learn amazing things as a volunteer. I became great at speaking to the media, going to the legislature, testifying, building coalitions, and running events. And and I wanted it to be a career because I feel like it's honestly the only thing I've ever wanted to do. Um, Over time, I've learned that a major mass shooting is what drew me in, and also there is a day-to-day relentless impact of gun violence on people in our state and in our country. And it has a disproportionate impact on Black and Brown populations, and others. And I think I've deepened my understanding of what the issue really looks like, and part of my job is to deepen it for other people. I'll just say, Texas Gun Sense, Heather, was grew like your organization did. There wasn't a Texas-based organization that could be tailored to fit our state. Um, and after Sandy Hook, some people came together to do just that. And so I had been their partner for a long time, and then I came to be the executive director. And and I'm incredibly proud, and it's also incredibly hard. It's hard work. And I think we'll talk a little bit more about that.
Yeah. All right, so we've heard from a teacher and a social worker, and now I'm going to turn it to a pediatrician. So, Dr. Palmer, you're a fellow pediatrician, and gun violence is not something you would normally expect out of residency training to be something. How did you get involved in this?
Well, I can certainly say medical school did not prepare me to take care of children affected by gunshot wounds. We definitely learned a lot about other things, pneumonia, things like that. But I think there's the clinicians on this call probably all have a patient they remember. But I'll try and keep this short. But I was a pediatric resident in the ICU. And I still stay in touch with this family to this day, but they had a child that had bronchiolitis and just got really bad one night. And they looked over and they're like, saw him just like huffing away. So they got really scared. They threw the whole family in the car and took off to the emergency room, as they're supposed to do. Because of the emergency, they took dad's car, and they normally don't take dad's car. They take mom's car. And I think mom's car was somewhere else. Big brother, and on the way to the emergency room, reaches forward and finds dad's gun in the back pocket of the seat. So, my son. And unfortunately, had a gunshot wound through the forehead, kind of out the side. Survived, but both children were admitted to the pediatric ICU and adjoining rooms.
Mommy, what do you mean?
Baba. My children hear about this all the time. And so this was just the first time where we had, hopefully the only time this happens, but we had adjoining rooms. We had the pediatric trauma team, and then, the PICU taking care of, bronchiolitis and a gunshot wound. And not all the time do pediatricians interact with trauma, right? But it really became apparent that we are putting Band-Aids on these things, and we really need to go upstream. And how can pediatricians who live and breathe prevention, how can we start partnering in the most common cause of death in children? We've got gunshot wounds and motor vehicle accidents. So how can we start partnering with them to see if we can really start moving the needle on these things? So in addition to the safe storage, I'm also a car seat technician. So trying to equal representation.
Mom.
All right, Paul, I'm anxious to hear about your personal story, and I also really want to learn more about your office. I'd love to know about how it started. What were the moving parts that were required to make it actually happen? Give us an insight into at least whatever you can tell us about how it came into being.
Yeah, start off with myself first. I had the fortunate opportunity to start my working career in law enforcement and criminal justice in Southern California in the 1990s, right? It was in the middle of the heyday of gang wars and gang violence that was going on. And, after years of working in that, I began to think, as many others did, there's got to be something better we can do to address violence in our communities, gun violence and gang violence, instead of just, it felt like from the law enforcement criminal justice side, we were just reacting to what was going on. Started looking at, had a bigger interest in understanding those people impacted by violence, not just the victims, but the community, the individuals involved in violence. And there's a common denominator amongst everybody, and that is nobody wants to die, right? Nobody wants to get hurt, regardless of who you are. So I began to look at, took a bigger interest in developing sort of models and programs and getting to understand what works, what doesn't. Was able to partner with the Department of Justice, the Office of Juvenile Justice and Delinquency Prevention, and learn from them for many years, and the National Gang Center. Began looking at comprehensive approaches to gun violence in communities, looking at, realizing that in cities around the country, there's thousands of people every day working in a city, either directly or indirectly, to address gun violence. And whether they know it or not, they are the work that sometimes they do, whether it's addressing gun violence downstream or upstream. And the idea is really, what if we all got together and were able to do our work of what we do best, but in a coordinated manner? And that's really what drove the second half of my career is looking at building comprehensive models based on different sizes and assets in cities. I've done that in Southern California and Denver and Louisville, and now here at the state, this is my first job working from a state level office, looking about how we can support efforts across the state. Across the state, and I tell you, it's completely different than running offices at a local level, right? Because you're just the huge geography of it. For our office, the North Carolina Office of Violence Prevention, was formed in 2023 by executive order from Governor Ray Cooper, and he created our office. We're placed under the Department of Public Safety, so we're not a standalone agency. We're a division under the Department of Public Safety, and really given the task to coordinate statewide efforts to reduce violence, harm from violence, and firearm misuse. The way we were formed, really similar to a lot of other agencies, really, the office was formed in response to recommendations from a racial equity and criminal justice task force that was formed in the state in 2020 following the civil unrest related to the George Floyd and Breonna Taylor shootings, among others. And the recommendations that came out of the task force were really looking at, how do we address the systemic racism that's present in our systems, and what do we look at an alternative way to addressing violence in our communities, particularly in supporting community violence intervention programs. So the governor signed our executive order, created our office, and our primary goal is really we serve as a resource hub around the state, and a technical assistance hub around the state, where we look at helping rural areas and urban areas. We bring people together. We really promote a public health approach in addressing violence. The idea is building a statewide ecosystem that is learning together and working together to reduce violence in our state.
So it sounds like there was a crisis that unfortunately is often necessary in many states to action. But then there was a task force. So there was agreement, okay, we need to look at this. And then people took the task force recommendation seriously and led to the office. How long have you all been organized as an office so far? Do you know?
I've been here about 8 months. We've been in office for about 2 years, going on 3 years. It took, of course, when the order passed, the time we got set up was some time, but we're still a relatively young office in the sense of growing. For about 2.5 years. I think we've been in practice now.
And what template do you use in your office to decide what to do? Do you look at other states? And if so, which ones do you look to as good role models for what an office like yours should look like?
Well, first of all, we had to look at what is it that we can provide. So our office is different than other OVPs around the country, state offices. When we were formed by an executive order, we didn't have a fiscal note attached to us. So we don't really have any dollars to give out to local jurisdictions and stuff like that. We partner with our sister agency, the Governor's Crime Commission, that gives dollars out. So we wanted to look at what could we do best. From an office perspective, we're very small. What could we do? So we looked at our really 3 priorities: are enhancing cross-sector collaboration and coordination at the local level, at the state level, to address violence. How do we strengthen community violence prevention workforce? So what sort of trainings and workforce development programs we can put in play to help those folks on the front line, and then empower and prepare local communities to address violence. So really going in and helping communities how to set up models. So as I said earlier, we're more of a resource hub, a technical assistance hub, where we look at 4 core functions, and that's connecting. So we connect folks around the state, cities, and agencies to resources, whether it be technical assistance, whether it be to funding opportunities from other areas. We convene, we network a lot. We do regional convenings where we regions together, folks doing this work, and we introduce them to each other, and they share resources, and they share knowledge, and they build partnerships. We build collaborations, and we provide training. So we do a lot of behind the scenes technical assistance work.
Amazing. And Dr. Palmer, you've been working, but I don't quite understand what your work is and how it connects. Can you help explain what you've been doing and how you've cooperated with these efforts at the state level?
Sure. It started right before the Office of Violence Prevention executive order that Governor Roy Cooper had a firearm violence roundtable, and there were a lot of physicians at the table. And from that, I believe I was asked to be kind of one of the like physician representatives of the Office of Violence Prevention Advisory Board at the time. There were several other physicians as well. Um, and so kind of getting the office up and running just from an advisory board standpoint. It was multi-sectorial. There were CBOs and law enforcement, et cetera, and they put out a pretty robust plan at the end. And then hold on.
And we
As
can
I
come back
rolled
to
off of,
Okay.
they asked me to join the Gang Intervention and Prevention Task Force. So I've rolled off of the other advisory board.
Mhm.
And so on that task force, I represent healthcare. And I believe there's myself, and then there's one other nurse practitioner. And so they have divided us up into prevention levels. So we have a primary prevention group, secondary, and then a intervention group. So me in prevention, I'm with I think we've got childcare representatives, CBOs, school. So I'm kind of in a nice little group there. And so we're developing recommendations currently.
So it sounds like diverse representation from stakeholders is really key to making this work. Yeah. Now, your situation, the political situation, and we are always trying to remind everyone that this should not be a partisan issue. This is an issue that affects everybody, but unfortunately gets hamstrung by politics sometimes. You're in a state that has had a fairly supportive governor, and then contrast that with what we're experiencing in Georgia and I think in Texas, and we have different challenges. So I'd love to learn more and better understand the difference in the strategies when you're trying to build what you built, the North Carolina experience versus what Texas is struggling to do. And, I might ask Nicole to jump in and just offer your perspective on the Texas experience, because that's, I think, going to resonate a lot with us here in Georgia.
Yeah, I mean, you kind of said it, Mike. It is really similar. I mean, in all the years that I've been doing gun violence prevention work, um, we really haven't held the political power we would need to pass comprehensive gun policy reform. What I didn't realize when I was a brand new advocate is that a lot of what we would do would be defensive work, trying to stop or speak out or message the fight against bad policy. My first legislative session was in 2015, and the Texas legislature passed campus carry and open carry of handguns, and it was like I realized what we were up against. And then frankly, since then, things got even worse. The legislature got more extreme. We're a nonpartisan organization. The issue is nonpartisan. I believe that in my heart. I think we all do. Um, and consistently polling in Texas has showed us that we are in the majority and on the right side. And but there's this discrepancy, right? And I'll give an example. So, last year, there was some polling done that showed that 88% of Texans, including 81% of Texas voters, Republican voters in Texas, support extreme risk protection orders, or red flag laws, as they're often called. That same session, the Texas legislature passed a ban on extreme risk protection orders in our state. That's the most extreme anti-red flag law bill in the country, as I believe, and it's setting a concerning trend. It blocks orders from being implemented that may come from another state. So maybe an order is issued in Colorado nearby or New Mexico, and a person is not able to access their firearm for that period of time for a very serious reason. They can come to Texas, and there's absolutely nothing anyone can do. Or you might face a felony jail sentence. It's really serious. And so I don't say this to like be doom and gloom, but I just say that like there is people out there in Texas who support safe gun policies, and then our legislature taking really extreme steps. I will also say though that oftentimes you are able to stop some bad policy. There were other bills that didn't pass last session, like a bill that would have allowed 18-year-olds to carry handguns, that would have allowed people to carry handguns in places like hospitals, schools, polling locations. That's just a snapshot of some of the bills that didn't pass, and we fight against those with our coalition, and we credit ourselves and our partners with kind of holding the line sometimes, which is what you have to do. But we also we know what we're up against, and there is a if there is a policy that is set to pass in the state, they can do it, and it can be a really bad policy that most Texans don't even know about, and don't know that it's going on. So it's part of our job to let people know that and get them engaged in the process and have them understand, Republican or Democrat, whoever they are, gun owner or not, that this is the reality and we need their voices. And that's actually been part of the work we've been trying to do, is get more voices in the room that kind of shows that broad spectrum of Texans who are on our side.
All right, so the next question that I have, I think starting with you, Nicole, but I'm going to ask for everybody to share, is what are your proudest achievements, or what are you most excited about? And every state's going to have a different one, but what can you share with us and give us some hope? And I also want to take this moment to remind everybody on the call that we want your questions too. So I'll be looking in the Q&A. If you have questions, please send them on our way. But Nicole, if you could share with us, whatever it is that you feel like, well, we did it. This is a hard fought thing, and we succeeded here.
Heather and I have talked about this a lot, so she'll know what I'm going to say. But in 2023, that was the session following Uvalde, and it was very, very difficult and hard. And we really worked to support the Uvalde families and legislation they were pursuing. It did mean that it was a session where there was a little bit more opportunity for discussion, when often that hadn't been the case. And what I mean is no hearings, just nothing on good bills, safe gun bills. And so we had this idea to promote a policy that our organization wrote and had filed, that would require school districts to distribute secure gun storage information to parents and guardians. We have 5.5 million school children in Texas, huge state, lots of homes and schools and communities that you can impact. The bill got a hearing. The bill did not get any further than that hearing. But because, we know our legislature and we know our people, we were able to kind of work quietly behind the scenes. And this is a plug for working quietly sometimes. I'm going to say it really is a strategy, to have that policy tacked on to a big school safety package that was passing that session, because that was where the energy was and the focus was in the wake of Uvalde. For better or worse, there are some problematic things in that bill, and some good things, and our policy was one of them. And then we were able last session to add an additional requirement that information gets distributed 3 times a year. I just tell the story to show you that there is a way to do it. Sometimes it's a little bit of strategy. It's frankly sometimes a little bit of luck, right moment, talking to the right person. and kind of quietly getting whoever can help you to do that. Sometimes that's across the aisle. We've done that, and they will at best do that quietly. They're not going to be vocal about it, so you've got to, work with what you have. And now we're working on implementation, outreach to school districts, to make sure that they are effectively sending out the messaging. And that's been a really meaningful and frankly fun thing to work on and to engage our community on.
Outstanding. All right, I'm going to make my way to Georgia through North Carolina because I want to bring it home at the end there. So, Paul, can you share with us just a few successes, wins that you've observed? And, I recognize you've been there for a short period of time. Maybe it's preceding you, but what signs of progress do you see in North Carolina?
Yeah, I'll just point out two that we're seeing. One is the growing number of local jurisdictions, that are implementing their own offices of violence prevention. So the number of local offices that are growing around the state of North Carolina that are coordinating local efforts to address gun violence, and then just the overall number of collaborations that are growing across the state. So bringing people together, the networking is really paying off for us. Folks are realizing in regions and local towns, if they come together, they can work together better, they get better results. And we're starting to see that. The other thing that I think it's successful for us is when we talk about the politics that's in gun violence, sometimes you have to look at when you're doing large collaborations, what's the consensus that you can work with? What can you get people to agree on? So in our state, we have a really robust, successful gun storage program campaign. It's called NC Safe. And it's statewide, and it's a huge campaign that focuses on, it doesn't take a side as to whether guns should be controlled or not, whatever the issue is. It's if you're going to own a gun, own it safely. And this is how you store it properly. This is how you handle it safely. I think that campaign's a huge success. It gets the support from a lot of people around the state, from both sides that look at the gun issue differently and stuff. So sometimes I know it's hard, but when you're running large collaborations, is you have to capitalize on what you can get the consensus on and move forward with that.
Mm-hmm.
Does the political divide in North Carolina still exist between, gun firearm policy? Sure. But there are things that we've been able to focus on. And one is the importance of OVPs at the state and local level, and the importance of gun storage campaigns.
I am feeling some themes here from what you all are telling me about, one of which is that it's critical to create the setting for a constructive conversation. That, in the well of the Senate, you're not going to get consensus or compromise. And maybe even a hearing is not the right place. But behind closed doors and getting people who really want to work on problems and solve them, you might see some success there. And I love the take the win motto. We are definitely redefining what is a win in Georgia all the time. We're getting some great questions in the chat. So I want to get through this one and then we're going to turn it over to the audience. Dr. Palmer, what kind of wins can you point to?
I would echo Paul. I think NC Safe has helped us change the narrative and will help serve as the jumping off point to handle the more divisive topics. So I've been working with NC Safe since they started in 2023. And I think it's key that it is run through the Department of Public Safety. It's not Health and Human Services, it's public safety, which really matches how they describe that this is a public health issue. Looking at Georgia, I think you guys have a Department of Public Health, not public health, public, is that right? You have both public health. Okay, so you have both. So I think that would be great. And then we used, they were called the Burn grants, which I think is also available in Georgia through something similar to the Governor's Crime Commission. So that's kind of like the agency that it's run through. So, I mean, it's really been fantastic. And I think at my organization, by starting with secure firearm storage, it has really totally shifted how they view our work. Prior to that, when we would go out in the community, were supposed to represent ourselves and not the organization. But now they said, yeah, we would love for you to represent who we are, because this very much is a pediatric issue. So I think I'm really excited that it is being destigmatized, and it will allow us to, now we're talking about gang, youth crime and things like that. So
Yes.
yeah, I think it's great.
Thank you. All right, Heather, I'm going to ask you the impossible. Georgia Majority has done a ton of work in a short period of time, but we don't have a whole lot of time tonight. So if you could, in just a couple of minutes, give folks on the line who don't know what Georgia Majority is about and what it's been doing a sense of, we started here, this was our focus, this is what we did, now we're prioritizing this, just a quick snapshot of the gist of it. And then I want to get to the questions that the audience is putting to us.
Yeah, and I think I can tie this in with, the wins. So we try to keep it really simple, and the only thing that I would like to add to that beginning slide about what policies work, what we know works. And I love that Paul has spoken so much about what they're doing in North Carolina. But we focus on 4 policies. I always say Georgia's an opportunity state because we have nothing. And if we can get anything, that's a win, right? So we really just focus on foundational laws, so universal background checks, extreme risk protection orders, secure storage, and funding for community violence intervention. We just say funding for violence prevention initiatives because we really include the education around secure storage as a part of that 4th priority. And honestly, I mean, I think that we've learned so much from our southern neighbors. That has really, I mean, for me, that is where I believe that's the first step that we will probably take, is around education, around secure storage, and maybe one day some funding, or at least support for the violence intervention work that happens at the state level. They're definitely growing this movement in Georgia, having a state-based organization that is solely focused on changing Georgia laws and reducing rates of gun violence in Georgia. That's a win in and of itself because we started something from nothing. There wasn't an organization doing this. But we know that our organization is having an impact. Just from the volunteers that we have who are in this work with us, and everybody has, fat paychecks of zero that, they're collecting. But we know because this past session, I can't get into all of the ins and outs of the silliness that happens, but there was a bill that, had been a tax credit for secure storage devices, and then one of our very extreme state leaders tacked on a 5-day tax holiday for all gun and ammunition purchases. For all intents and purposes, I thought we were playing defensive work and we were going to lose this battle. But they actually pulled that bill, and the word on the street was that the reason why they pulled it was because they didn't want to get in trouble with suburban moms in an election year. And I know that that is our presence. We show up every day at the Capitol. We have volunteers every day during the session. A lot is because of the work that Georgia Clinicians has done to organize physicians who stand with signs and talk to legislators. But I know that we're having an impact, and there's nowhere to go but up. So we will continue doing this work until we have more wins to brag about.
All right, I'm going to jump to some great questions that we have in the chat. And the first one I'm going to pose to Nicole, although I think any of you could probably tackle this one, but it's an important one because it comes up all the time. The question is this: how do the panelists explain the discrepancy between citizen views and legislative action? Is it the gun lobby? Is it something else? Why is there that disparity? And Nicole, obviously, you kind of highlighted that discrepancy right there. How can we understand that?
I mean, I do think it's the gun lobby. And that answer doesn't feel good, but I think that's the real answer. when we had our bill and we were actually looking for Republicans to file the secure storage education bill, we thought, what, we're going to go ask the Republican chair of the Public Safety Committee. Why not? And his staff asked us, have you shown this to the gun lobby? Have you shown this to the NRA, lobbyist? And we said no. And he said, we'll show it to them. And if they like it, come back and we'll look at it. Well, that basically meant no, not interested, because that means that if you ask them, they're going to say, absolutely, we're opposed to that. And they testified and they were. So it's like, the power that they hold is great. And until there are people who are not working so closely with special interests to pass bad laws or keep good laws from moving forward, we're going to be in a similar situation, but I believe it can change.
Do y'all in North Carolina feel the same kind of thing? Is the gun lobby that powerful and loud, or is it different?
I think it's equal. I think there's different sides to the picture. And I think for our office is, we understand the importance of advocacy and policy. We're tasked with sort of implementation. We're tasked with what's given to us to use the tools right now that we could use. And we focus on that. We focus on teaching local jurisdictions, here are the tools available to you right now to address gun violence. While the rest of that's being hashed out. Let's move forward what we could use the tools now.
Yeah. So trying to just pivoting, just a judo move to try to get people to think about it differently. Yeah. All right. Got another question here. Given the difficult, I'm sorry. Go ahead, Heather.
There was something, I think that this is very related to the gun lobby, but I honestly think that it is also a messaging war that we just are like several decades behind on. I think that was an intentional move by the gun lobby, but that was a very successful campaign to make average people who aren't maybe thinking so much about politics believe that, that the Second Amendment means unfettered access to firearms, that any step to regulate firearms is somehow unconstitutional and infraction of your Second Amendment rights, your constitutional rights. And that was a messaging campaign that was very successful. And I think that even though most people agree in theory with all of the polling that we know supports basic gun safety laws, there is also, I think, been implanted in people's mind that you can't infringe upon Second Amendment rights. Like it's they use it almost as a phrase. And that's something that our messaging needs to combat and talk about this more from the public health framework, and all rights are basically, they're measured, right? Because your rights, when they trample over somebody else's rights, are limited. And we know that, voting, free speech, everything has limits.
All right.
I think in North Carolina, I've heard a lot of the comparisons with, the public health approach to reducing motor vehicle accident deaths. I think we've heard that on a national scale too. But I think like NC Safe is, the solution wasn't to remove cars from the road; it was to make the cars safer. So this is not a gun ownership issue. And so NC Safe and what we do in the hospital is actually at no point in time do we ever ask someone if they own a gun. In my head, I'm assuming yes. Currently at the hospital, we're at about a 75% gun ownership rate. So I don't need to ask. The question is, hey, we've got gun locks. Could you use one? And so again, we're not taking your guns. We're just trying to make them safer.
So it sounds like you actually answered the next question here, but I want to pose it anyway because it was written by one of our audience members. Given the difficult political climate that often makes legislative progress seem out of reach, what steps can we take to encourage behavior change around evidence-based interventions? Community norms surrounding safe storage is an example. I think you've already answered that, but if you wanted to add to that, any of you, please do.
Since I was talking, I'll wrap up. I think that is what we try and do when we go around to clinics and go to communities as we're doing this education is again, that you do not ever need to ask someone, hey, do you have a gun? It's, hey, could you use a gun lock? If they say no, the next question is, do you know anyone who might? Because most people have two neighbors, so they know someone who could use a gun lock. And then in the community, we actually have toy guns. And so we actually will have them use the lock in person. And we have different lock types that they can use because the first time they put on a gun lock, I would rather it not be a real gun. And as we're doing all this, we're trying to debunk a lot of the myths of like, I need it locked and loaded. I need it fast. And so as they're kind of, manipulating this lock, you can say like, oh, hey, like, look, that was your first try and you did it in 10 seconds. Like, so that's been really helpful. And we actually have been able to get those kits in our clinics too.
Mike, if I can jump in, Georgia
Please.
Majority has our action alert this month, and it's on our website, but it really is all about actually that culture change. It's not about advocating for, to legislators. It's really about advocating to your community. This past Friday was National Gun Violence Awareness Day and Wear Orange. And so we were asking people to film videos about why they were wearing orange and why they got involved in this and post to their social media. June 21st is Ask Day, which is also a national campaign, but this is really more about normalizing asking, if your child is going over to somebody's house to say, if you have guns, are they securely stored before you send send your child over to another adult? And that's just more about sharing that message and normalizing that conversation. And that's something that we all can do in our communities. So would love for you guys to check that out on our website.
All right. Got a question specifically for Nicole. I think there's some Texas fascination here on the call on this audience group. Nicole, how difficult was it for you to come up with a messaging in your legislation about safe storage education? Did you have a lot of resistance from the legislators?
Well, yes and no. So, and I'll try not to get too wonky about the legislative process, but like I was saying earlier, when our bill was a bill, yes, we got some pushback, mainly from the NRA lobbyists. It's not like the hearing room was flooded with people saying this is terrible legislation. It was really just a very powerful group that was saying no to it. And what they said was, I remember this specifically. We believe in safe storage. It's all over our website. We just don't think that we need to be making people do things or legislating things. And frankly, we disagree there, because secure gun storage laws have been shown to save lives. And so, yes, there was pushback. But because we played the quiet game and knew who to talk to and where not to create a lot of noise and fanfare to not attract, frankly, negative attention, when we worked to get this policy through as an amendment to another bill, that was the strategy there. Because yes, if there had been a lot of noise, there could have been more pushback and it might have been stripped out. But we made sure it was protected by some of our allies. But yeah, a lot of times the form of pushback comes in the form of, we won't even hear your bills. We won't hold a hearing on your bills. And so you're not able to have just a good faith conversation about a sensible life-saving policy. And that, I think, will start to change as our legislature changes and the landscape in our state changes, which I believe it will. And I think we'll start to get those hearings. And so part of the work I see us doing is building the groundwork to get there. When things shift, we'll be ready to hold great hearings and give great testimony and bring in all our partners in the medical field and others to stand with us and actually move those policies. And it may take years, but that's what we'll do.
All right. The last question that I've got is about money. It's about financial resources. And I think this is a good one probably to wrap it up because it's an important one. And the questioner says, having been active in this movement since before the Brady Bill came about, that's 50 years ago, I'd like to know how each participant's groups, uh, how you do in fighting the gun lobby's very large budgets and influencing legislators' votes against any gun safety measures. And I'm also curious, I might like to tack on about how do you secure funding for the things that you want to see done? That's one of our big struggles in Georgia is how do we convince people that we need a budget for this and be at least just like Texas or North Carolina? Come on. So who can help us out with this, the funding wars?
I can speak to the sort of the community violence intervention aspect of that, right? So we saw some unprecedented amount of funding over since COVID, especially through American Rescue Plan funds that came out and supported the growth, the huge growth of community violence intervention programs around the country. The majority of that funding is expired or set to expire at the end of 2026. So there's this huge fiscal cliff that a lot of these cities around the country right now that are seeing some significant results in reducing violence are facing because that money is going away and it's not coming back, particularly under this current administration. So, what are cities going to do? And I think the biggest challenge that faces everyone right now in cities is we're seeing some huge reductions in cities related to gun violence, significant numbers, but yet nobody can tell us why. Right? We know it's this complex issue and we know there's this comprehensive approach, but when every city there's law enforcement programs, there's community violence intervention programs, there's public health programs, we know we're seeing reductions, but nobody can pinpoint to the exact reason why we're seeing these reductions. So for community violence intervention, two parts to that. One is building community violence intervention programs using existing resources in communities, partnerships, collaborations, instead of one agency saying, I'm going to do everything. I'm going to partner with everybody else. We could build the same model. And that's the preference that I take when we build models in cities. It's let's use existing resources and build from there. Now, don't worry about bringing money in. What can we build using existing resources? And two is the data. I mean, community violence intervention, I've seen it work in cities. I believe in it. But historically, when it comes to evidence, it's still a promising approach, right? We still have to see the research behind that and show that it's having success. So it's being creative with the funding, creating models, using existing resources, learn how to do that. I think the damage of so much money coming into the community is people did not have to do that. They just got funding, created all these new programs without thinking about sustainability. And now we have to think about that. And two is really figuring out collectively across sectors what is driving the violence down right now.
Yeah. Nicole, Heather, your thoughts about your struggles with money, funding. How do you create something that's sustainable?
I'm going to let Nicole go.
Well, we still kind of like what Heather was saying earlier. We have all we have to do is, there's only up from here, I hope, and we have progress that needs to be made. Um, I will just say on a big picture, I do think it's important that people listening know that advocacy for budget is advocacy. Sometimes it's legislative and we're pushing bills and policies, and that's kind of the one we're more familiar with. But putting money into the budget to support offices of violence prevention, to support community violence intervention organizations, which are, there's growing ecosystems of those in our states, thank goodness. For secure storage, awareness campaigns or whatever is incredibly meaningful. And there is a way to do that work. In Texas last session, we were able to secure 2 million for a year for 2 years for community violence intervention. And it's really just, it's not enough. And the money could be made much more accessible for what the organizations really need. So we have some work to do, but that was a first. And so, we're getting somewhere. And what I love is being a partner with our CVI folks, community violence intervention leaders, and working with them to bring them into the Capitol so they can get in front of lawmakers and share their powerful work, because it will just give you the incredible goosebumps to hear them say, I was incarcerated for 20 years because I committed an act of violence that I regret, and now I'm here to do
Mhm.
this work in my community to stop this from happening to others. I think it's a powerful message at the legislature and and everywhere in the community, and that there's a lot more work we can do to and we need to do to secure more money for those programs.
That's fantastic. Nicole, you've given me so many quotes I've written down, and I'm going to attribute to them. I love this. Advocacy for budget is advocacy. That is
Yay, yeah. I
beautifully
feel like I'm
put.
a
I love that.
storyteller tonight. I don't know. You guys are
This is
bringing it out
this
in me,
is
but there's a lot
great.
of stories to tell, good and
Yeah.
bad. Yeah.
Well, it is past 8 o'clock. I want to wrap it up, but I want to give Heather the last word on this. And Heather, if you want to talk about the financial challenges or anything else to bring us home, please do.
I'm not going to talk about challenges. What we are doing and what I hope that all of you who are still hanging out with us at 8 o'clock on a Tuesday night here in Georgia, please join in on our coalition. Please sign up for our newsletter. Please help us fund this work. You know, I I believe that we will have victories that we can talk about. And, part of the reason why we wanted to talk with other states in the South is because, there are examples. I mean, Texas is politically probably in a worse position than we are. And yet they have a, secure storage education campaign. They have a law that Nicole talked about requiring that schools send home secure storage information. So we can do this, and we've just kind of gotten started organizing, and I know that we are going to have victories to talk about. I feel really good about the movement that we've built, and just encourage everybody, please go to our website, please donate. We are doing our first annual Champions for Change legislative awards and year in review on August 22nd. So I encourage everybody to join us, become a part of our host committee, and support this work, and just learn more about what we're doing. You don't have to, this does not have to take over your life. You can literally make a call, once a month or once a week. Come down to the Capitol and talk to legislators with us if you want. But I know that we're going to do some good things together with your help. So all good things are coming, because there's nowhere to go but up.
Amen. Well, thank you all so much. Thank you for taking the time tonight. Thank you for your long day at work, Paul, and everybody else who contributed their time and efforts to this. Hey, remember, this is Gun Violence Awareness Month, so it's not too late to wear orange, just to let people know that you're thinking about it. Stay tuned for our next webinar for DeKalb Dems. It'll be sometime in July. We will let you know when, and y'all have a great night. Good night, everybody.